Bismillahirrahmanirrahim. Iyyaka na'budu wa iyyaka nasta'in. Dear friend, we have already started series of nervous system disease, all nervous system related disease. Myasthenia gravis, Parkinsonism, multiple sclerosis, syringomyelia, myasthenia gravis, other related nervous system disease, all nervous system related, MND, muscular dystrophy, muscle related. Now we will discuss about little bit physiology and pathology and homeopathic treatment of autoimmune disease of nervous systems, particularly multiple sclerosis and myasthenia gravis. And Parkinsonism, substantia nigra, and demyelination of substantia nigra affect the dopamine production, decrease the dopamine production. We already little bit discussed about the physiology of myasthenia gravis related and Parkinsonism and multiple sclerosis, and even in epileptic, different type of epileptic seizure. I have already area wise divide epileptic and with homeopathic treatment. Now, brothers and sisters, as you know about our central nervous system and autonomic nervous system, first I will discuss about little bit about myasthenia gravis, MS. I will already discuss about autonomic nervous system, sympathetic and parasympathetic system, and their neurotransmitter, adrenaline, and sympathetic system, pre and post ganglion neurotransmitter is adrenaline, and parasympathetic is acetylcholine. And myasthenia gravis, and it is an autoimmune disease, and affect the acetylcholine receptors, because parasympathetic effect of acetylcholine is due to its effect on acetylcholine receptors. Cholinereceptor, as we already discussed about parasympathetic effect, parasympathetic effect, cholinomimetic effect, cholinereceptor effect. This is the cholinereceptor, disease of cholinereceptor blockage. Acetylcholine is not properly, and there are other diseases also related to acetylcholine, but this is related to their enzyme cholinesterase. And myasthenia gravis, I already discussed about the acetylcholine function, their physiology. Then we will discuss their pathology. As I already discussed about acetylcholine function in every part of our organ. Acetylcholine its effect is parasympathetic, and at on nervous system, on muscle level, on cardiac level, metabolism level, gut level, genitourinary tract level, acetylcholine effect is very prominent. At some organ, acetylcholine work as a accelerator, at some other organ its effect as a brake. I will already discuss about the acetylcholine effect on heart. Its section is as a brake, and on gut it is a accelerator, because it's increase the gut motility, the gut secretion, the enzymatic secretion, and peristaltic movement. Everything is it's affected. Mimic effect, parasympathomimetic. while in cardiac it is as a brake because it decreases the heart rate, it decreases the systolic BP, diastolic BP, cardiac force of contraction. First, know about the acetylcholine effect, then the you can easily judge the symptom of myasthenia gravis related to homeopathic drugs. I already discussed about acetylcholine effect on an eye, you know about on radial muscle and circular muscle, you know about its meiotic effect. When symptomatic acetylcholine is at eye, it is cause myiasis due to you know about its relaxation of radial and contraction of circular muscle of eye, and then its effect on accommodation, double vision, and the symptom and myasthenia gravis, and about process of eyeball, eye muscles due to their central effects, due to the acetylcholine on eye muscles and on accommodation. Similarly, I already discussed about its effect on smooth muscle and its skeletal muscles. And some other organ on lungs, its also effect is, you know about the pulmonary bronchodilation and bronchoconstriction. It's cause bronchoconstriction and increase the secretion. That is why in allopathy either we use anathema sympathomimetic drugs or anticholinergic drugs like atropine related drugs, other drugs, you know about it. Similar in myasthenia gravis, the acetylcholine receptor is blocked. Acetylcholine, and there are no place for acetylcholine and choline receptors. These all symptoms, the acetylcholine effects automatically will be blocked because there are no receptor, there are no place for acetylcholine on receptor, there is no acetylcholine function. Then if you remember the acetylcholine effects on meiotic effect, eye muscles and accommodation, and you know about muscular effect, smooth muscle, skeletal muscle effect. That is why usually we use in homeopathy, we have targeted receptor and acetylcholine function in all related drugs, either drugs which affect an allopathic system of medicine. You know about number of drugs that block the acetylcholine receptor, and the mineral category, the plants category, the animal categories, the drugs related to use for myasthenia gravis, sarcoids, Morgan bowel nosodes, classic nosodes because it's autoimmune disease. I know about autoimmune, you know about immunology, you know about our immune system. That is, we have now little bit and allopathic drugs, which is homeopathy potency from allopathic drugs and from predictable or from acidic groups. They are very effective in myasthenia gravis, relieve the symptom very rapidly. As regarding, you know about paraxylene. Paraxylene is 100 mg. Now it is very rare, but about 30 or 40 years ago, paraxylene is common use on Pexid trade name. Its generic name is paraxylene and its trade name is similarly Largictel. Trade name and generic name is chloropromazine. And same category drug